Welcome back, dear viewers, and now we have our first guest. It's going to be a dental segment for now.
Yes.
So, as you know, my dear viewers, in the age of social media, smiles have become trends, filters, and even personal brands. But where does beauty end and where does health begin? So today we are going to explore the fine line between cosmetic desire and medical responsibility with Dr. Mohamed Fouad, cosmetic dentist and member of the Royal College of Surgeons in Ireland. Good morning, Dr. Mohamed.
Good morning, pleasure.
It's the pleasure is ours. As you know, we need to explore these kind of trends.
Yeah.
Either they are, let's say, fake or real or healthy.
Exactly.
So allow me to shoot with the first question. So, as you know, social media changed people a lot, and they've been under the influence of social media. So, do you think smiles today are driven more by trends or real health demands?
Yeah, certainly. It's all about trends.
Mm-hmm.
Certainly. I've been in Instagram since 2013. In the last 13 years, I see the trends changing, and of course, it gives responsibility to the practitioners who are providing the services they are due. So, and our service, or what we do in the clinic, that we should normalize these expectations and change it to something healthy and aesthetic at the same time, so we can reach a point in the middle.
Well, so it's not just, let's say, for sake of beauty. It's also sake of health, because even we know that the smile is, let's say your brand, your personal brand. If your smile is good, it's going to open doors for you. But if you have, let's say, a cracky smile, your chances of having a good life is now all because of trends.
Exactly.
So, what is, let's say, in social, what is the most common cosmetic dental requests you as a doctor see? If I'm a patient, I come to you. What do you think that will be my request?
Yes. As I told you, it's now changing from time to time. Let's say 5 to 10 years ago, everyone was asking for the most white smile I could afford, let's say. Even if it is against the health. Even if you are, we used to let patient go because
as white as they want.
No, we let the patient go out of the clinic.
Oh, okay, good. There's no chance you would do that.
Now, I see that the awareness has been changed dramatically nowadays. Everyone now is looking, so this is the trend now, for a natural smile. Even if they have white smile, they did it old back and they regret it. Now they have time to change it to natural smile.
How do you do it?
So natural, we have like factors or rules for the smile. It has to be straight, and this doesn't have to do with veneers. It can be done alignment with orthodontics treatment. It has to be as white as our eyes, as white as, not the most white fake. No, it depends from the person to person. And this again can be done with cleaning and whitening. It doesn't have to be with the veneers. In the end, if the shape is wrong, if it is broken, if it is like root canal treated, at this time we do EMAX or veneers or crowns, whatever it takes. And it doesn't have to be like 20 teeth set.
Yes, so that's not an easy job.
Yeah, it's a decision to be taken. Yeah.
But you said something interesting. The teeth whitening should be aligned with the eye white. So this is the balance. If it is like, you need to keep a balance between the white in your eyes and the teeth, so it's gonna give that natural look.
Yes.
Well, that's
the philosophy about it, when I talk to you, I have to look at your eyes, not at your teeth. So when I talk to you, my eyes automatically goes to the brightest thing in your face. We don't want this to be your teeth. You don't want people to look at your teeth every time you talk. No, we need to look to your eyes. So your teeth will be recognizable if it is very white or if it is yellow.
Yes.
People will see there is something wrong in your teeth. They will keep looking at your teeth. So what we need is natural white, maybe more than our eyes gaze. Let's say the white gaze we have in our eyes. It doesn't relate to the skin tone or something.
Well, that's interesting. That's very interesting information. Now, Dr. Mohamed, as a dentist, if a patient comes to you, how do you balance between, okay, the patient wants something, but you as a dentist see that what he wants or she wants is almost impossible, but how can you reach a mutual ground with the patient?
Yes. The patient wants something psychological. They see a good smile in the internet, they want same. So they are not going to tell me to do 20 veneers. They are going to tell me their expectation.
Yes.
Maybe their psychological problem, what I cannot smile like this. So what I do, that I explain the pros and cons for every treatment, and I start with the ideal treatment.
Yes.
And then with the treatment that it's not ideal. And then the last thing is that no treatment, which is an option, as they say in the Royal College, always say, you have to give the patient that there is no treatment, which is an option, and you explain the pros and cons for this.
The consequences of the decision that they will
exactly.
choose. Yeah.
Especially if it is irreversible. Maybe nowadays we put veneers without prep. It's called philosophic veneer. When I do this veneer, the patient can remove it.
Yes.
So at least I'm not feeling guilty if the patient say that I want something white, I give it to them, because it is reversible. I can remove it. But if I'm going to touch the teeth, I have to let them think about it 1 time, 2 times, 3 times, and I give them this option to come back.
So it's like a no return point. You need to know all the options on the table, so you pick the most, let's say, practical one, because as you know, trends change with time.
Exactly.
So have you ever refused a request?
I used to, a long time back. Now people come with awareness. Now I don't see anyone come and tell me I want to do 20 veneers. But 5 years ago, I refused a lot. They need only ortho treatments.
Okay.
And the patient will say that I'm going to marry after 2 months. I just need something now.
Yes.
I told her, look, I will give you something very nice now. What you're looking for is something white. So I will do cleaning. I will do whitening. I can do some composite temporary veneers that you can remove it and then go on with the ortho treatment after you get married.
Yes.
So this is how I refuse it. I don't refuse it like, because if I told them no, they will go to someone else and they will do it. But now I'm helping them by saying no, but I will let them feel that they are the one who take the decision, not me.
Not you. Yeah. So what is the most, let's say, dramatic and let's say horrifying request came to you from a patient? Something almost like, this is impossible in all terms of humanity.
The problem is that they come for me again for second opinion after they do the mistake outside.
Fix the mistake.
No, they come to me say, I want 20 veneers.
Okay.
20 veneers means that I have to shave like 20% of the tooth.
Oh.
If it is natural tooth and the patient is young,
yes.
So what I have to do is that I will remove a lot. So I refuse, and then they go and then come back feeling sad because they go outside and do it.
Yes.
And then come again for me asking for second opinion because they have now problems with the veneers. It's not something that it can stay for lifetime. It can if it did wrong, if it was done wrong, it can harm the gums and the smell and like this. It has to be done perfect. So if someone practitioner taking it as a business, he will not be aware of the health so that much. So what they are going to do, they will regret what they did. So 20 veneers is a deadly business-based decision anyone can take.
20 veneers?
I mean to shave all the teeth to have white teeth. Although we can have this white teeth, but in a year.
You shave the teeth?
Of course. How can we put something?
And for how long, okay, one tooth, how long it would take to be shaved? In one set?
15 minutes.
15 minutes?
Yeah. Oh. If I'm doing it constantly.
Under anesthesia or without anesthesia?
Of course, under anesthesia. So the patient, if a doctor do it like this, that's why now we are turning to philosophic veneers. It needs no prep at all. If I'm going to do it, if I'm going to prep a tooth, it has to be it has to have a problem with the shape. It's a broken tooth that I see decay in the tooth. At this time I shave, I see a decay.
You need to shave it?
Yeah, because it already have a composite filling which is doing harm. So at this time I'm doing something beneficial.
I can't imagine the pain, because I only think right now, if I'm gonna do, inshallah I want a veneer, the sound of the shaver. It's the sound. That's why I hate going to the dentist, because of the sound of the machines. They are horrifying.
Yeah.
Yeah. They didn't, let's say, discover a mute for that machine.
No, until now they didn't discover anything about that.
Okay.
They discovered, you know, VR glasses. We put speakers so the patient will try to forget at least for a moment that he's doing his teeth.
Yeah. The pain that follows after the session is the most, let's say, horrifying pain.
Look, let's not make people afraid. Pain now is a history.
Okay.
There is no pain. Even with the prick, needle prick, we can put gel, not normal gel like for kids, the one with the flavors. No, there is stronger gel that you will not feel even the needle prick. But what is ethical here, that the patient will not feel if the dentist who want to harm his teeth, he will remove too much or little. He will not be aware.
Yeah. The patient will not be, let's say, involved in the procedure.
Yeah, he has to be involved in the decision. For me, I'm taking a lot of photos and I'm showing the patient. I'm doing with a microscope to have little bit preparation.
Taking this patient step by step with you.
And showing him what I did. This is his teeth. This is, he will live with it.
Exactly.
So I have, when I remove little, I show him. I remove little, I show him. And if I remove little and I have to remove too much because I find a decay, I have to show him before I remove it. See, this is the decay. I have to remove more. I say, so I take the confirmation from him before I do it.
That's part of your responsibility.
Yeah, and part of what I see that people, especially, I'm sorry, young girls, come to me crying after they did ortho treatment for a long time. They come to me crying because the dentist or the practitioner removed all healthy teeth and prepared them all.
So you don't need to remove the healthy one just in sake for, let's say, finishing the business.
Yeah,
you need to
I'll tell you something about it. 90% of the smile in the first four teeth, front teeth. You know?
So if the back is good, why would you do that? Why would you ruin the foundations of the jaw?
Exactly.
Yeah.
I mean, even if they are not perfect, the back teeth. When I'm talking, the four anteriors is the most important.
It's the most important.
Exactly.
No one's going to open your mouth and look into the back teeth.
Yeah.
So I have now a question. You know that they say perfect smile is related to psychology. Is it true?
Yeah. Let's talk about the other side of the line. People come to me with a really bad teeth and they lack confidence. I have to admit, when they do the temporaries, the start of the treatment, that it will look better, these people who really who really need aesthetics, their confidence changed dramatically. I mean, 180 degrees. One of them, like obese, like he's not caring about his look, his smell, he's smoking too much. After I do his teeth, I can see how neat he become. He become confident. I am sure that career-wise they have changed. And I can see them on social media because they are trying to show how good they are. So yeah, confidence, especially psychologically, it goes with this. But our concern is that the people who don't need, and who have high expectation, white teeth, while their teeth are good. This is expectation.
Why would you ruin something good?
Exactly.
Yeah. Well, Dr. Mohamed Fouad, thank you very much for joining us in Good Morning Kuwait. Unfortunately, we ran out of time for this segment. I would like to keep talking, especially the psychological side of dentists. So, Dr. Mohamed Fouad, thank you for joining us. You are a cosmetic dentist and member of the Royal College of Surgeons in Ireland, and the importance of cosmetic dentists. Now we continue with Good Morning Kuwait segments, so stay tuned.